All right, recording in progress. So, I'm recording this obviously for the other research interns' benefit. So, we've recorded a lot of these type of meetings so far this week with the screening, and so those are all on YouTube, and then they have like a cover photo that is like blue and pink and purple with like circles and says like screening, and then a brief description of like whenever like there was an example of a good one and an example of a bad one. Yes, honey, I do love that dragon. Yes. So she those are like all there. They're a little different than what this recording is going to be. So those are just an example of how you would actually do the screening whenever you meet together. But this is going to be an example of what should go on in your brain, typically silently, but if you get to the point where two people don't agree on to include or exclude, then this is the stuff that goes out loud. But so I guess I'm going to put a different cover photo on this video so that everybody knows that it's different from the other videos that we did, because this is not going to be exactly how people would want to do the screening. So with the big disclaimer in mind, we're going to go ahead and start. So Laksha, I want you to like read the title, which I know is going to be painstaking, but based on the lecture that we had yesterday, I get the vibe that some people don't understand a lot of the words in the titles. And if you don't understand the words in the titles, then you can't make a very good decision about whether to include or exclude the record because you need to know the words. So again, this is not how you will do it in your group. This is just an example, so that I can be more clear about like what kind of process goes on in your brain. So, of course, I want to say that this number over here is 4001, but that's not the record number. The record number is 4000, and it gets super confusing. And I think, did you say that there's a way that you can hide this altogether? Because man, it throws me off.
No, I just honestly, I just like zoom in and then I just like scoot this way so that I don't have to see that.
All right. Well, I'll just try not to look. If it's gray, I'll ignore it because it is kind of hard. Because
Mm-hmm.
if you get thrown off by one, then they're all thrown off. One of the students said that there is a way to hide this. Maybe they can volunteer that information later. But yes, so although the row number is 4001, the record number is 4000. So I will help. I know I think everybody should give you a round of applause because this is gonna you're gonna mispronounce stuff, right? And
But yeah.
I will everybody mispronounces things. That's why we had a game about pronunciation. So don't feel bad if you mispronounce it. I will correct you. And even in some cases, different people pronounce things differently. And then I guess sometimes it's possible, however unlikely, that I'm incorrect. But don't worry about the pronunciation. Just read 4000, the record number. What's the title of that one?
Record number 4000 is the linearity of the visual analog scale in patients with severe acute pain.
All right. So, yeah, that's a weird word. I don't even know. Okay. So what I already have my answers, but you can't see my answers, right?
No, I can't
Okay.
see your
Because if
answers.
you see my answers first, then it's not technically independent screening. All right. So what did you put for this one to include or exclude?
I put exclude because of non-pregnant population.
Right. So that didn't mention anything about pregnancy in here. Now, I wonder, I probably looked up the abstract to make sure.
Mm-hmm.
Well, let me just do that right now because there's an interesting thing that a phenomenon that occurred that I want to see if this is an example of or not. So bear with me while I go ahead and look up the abstract. So if it is an example, that would be nice because then I could. Okay. So no, of course it's not an example of what I wanted to show, but there will be some. So, you can probably just tell from the title that it doesn't involve pregnant women. But I think for like, just because a lot of people aren't really strong on this yet, you might want to just double check the abstract. So, yeah, in the abstract, it doesn't mention a thing about anybody being pregnant. Therefore, we would indeed exclude. So, if I go to scoot over, yeah, I put exclude. Okay. Now, read the next one,
Record
please.
number 4001 is an antenatal use of novel vaginal birth training device by a term primiparous primiparious woman in Singapore.
Yes, and I don't know if you noticed, but on the feed, the Google stream, um Primi Paris. So let me just, because again, Google can be wrong. Um, that's an important word. Do you recall that it was recently posted, um, the definition of it? Do you know what the definition of that word is?
No, actually, I don't think I remember. I think I searched it up and then I did it, but I don't remember or recall what it meant. Or I
Okay.
think it was something to do with like first first birth or first like
Yeah, they have.
okay.
Okay, so it's a four-syllable word, and it's a female who is bearing young for the first time. So not me, because clearly I've been at this a while. And then there's multiparous, which is they've had more than one. So let's see. Primiparous, and then it's Buddy. Come here. You can. Yeah, I know. You're done. Did you eat your breakfast? You want to say hi? So look, I'm multiparous. Okay. Okay, so we'll do multi-Paris. All right, multi-Paris is female who's given birth to more than one child. Okay, so this is why I'm going through multi-Paris. Okay, this is why I'm going through. I'm super multi-Paris. Okay, so this is why we're going through like reading the titles because there are a lot of words that I think are important for everybody to. All right. So Annie, okay, what are you gonna do? I can still hear you. I have a headset on, so you can also still hear me. So for this title, there's one word that's a dead giveaway that is either to include or exclude. What
Vaginal
is
birth training
well, yeah, that's definitely is it what's that word?
antenatal. That's after birth
Yeah,
or
so
birth or during birth.
prenatal is during and anti is after. And what do we do with any studies that are analgesics that are given for things that occur after?
Exclude.
What did you say? You cut out.
Exclude.
Yeah, right. That's exactly right. So we don't even need to read the abstract for this one. Okay. Can you read the title for the next one for me?
Yes, record number 4002 is clinical practice, restless leg syndrome.
Yeah, this was so vague. I mean, from the title, I would probably exclude, but because you guys are not experts yet, I would recommend reading the you want to watch Star Wars? So I do suggest looking at the abstract. So would you be able to pull up the abstract? I mean, the chances that it has anything to do with analgesics or anything to do with even pregnant women are very low. And so once you get to be an expert, you can probably just not read the abstract on that one, but let's be like super thorough. Let's be super thorough about this. So go ahead and read to me the abstract.
Yes, I'm pulling it up. So actually, there's no abstract provided for this one.
Oh my gosh. And so what do we do in that case? Do you remember?
Um, I just went to the, actually, no, I found it. I was able to
But
find it.
just for the learning purposes, hi, I'm here. Now I'm going to get my coffee. So just for the learning purposes of everybody who's watching it, what do you do if you can't find the abstract?
Um, for I low-key don't remember, but for this one, I just looked at the title. But
I think it's an assignment coming out today that if you can't find the abstract, that is not a valid reason for exclusion because it would create a whole lot of bias. Okay. So
mhm,
if before anybody says, I give up, I can't find the abstract, you are all required to ask and get a confirmation, either yes or no, from each and every research intern as to whether they can gain access to the abstract through their institution, which I'm sure you all pay copious amounts of tuition money for. So you should certainly have access. Now, before going to that extreme, it was a recent post on the stream that a lot of times the abstracts are not available because the study is not in English. Now, for the analgesic stepping stone study that we're currently working on right now, do we include or exclude studies that are not in English?
we exclude.
Correct. Now, once we become perfect and we're doing the overarching mega gigantic umbrella study, are we going to include or exclude non-English?
Include depending on if it matches up.
Right, right. If it's perfect and it's analgesics during pregnancy, but it's in German, then we're just gonna have to work real hard to find it in English or translated or at least write a cover letter explaining if it's not feasible. But because this smaller analgesic stepping stone study, we're not aiming for chef's kiss perfection. We are going to exclude non-English studies. So before you go to the extreme of asking every single one of your classmates and then having them ask their librarian at school, two librarians actually, because there is an assignment about this. And do you remember why I said you need to ask more than one librarian?
Because sometimes one librarian might not know, might be new, and then some other librarians would, warning, sorry, would give better access or probably would have more knowledge.
Exactly. So when you get to be my age, you realize that like people just say no or they don't know or whatever. And then if you give up, then you don't get anywhere. But yeah, so you want to ask two librarians. And then the other mistake that I saw some people make earlier on is when they're asking the librarians, they instead of saying, how can I get full access to this paper? And you will probably need full access to the paper in order to read the abstract. But news flash, flashing lights, do not actually read the full paper because that will violate PRISMA and that'll be out of order. And then I will cry many tears. Um, you would need to access the full paper because the abstract's there. Just read the abstract. Don't be tempted to continue reading. But if you say to the librarian, how do I get the full paper of this article? Don't say, I'm pretty sure that it doesn't exist, but can you try? Because then the librarian already has it like, oh, well, it doesn't exist, so I'm not going to try. So those are the two recommendations for asking your school librarian for access to these articles is one, ask more than one, and two, don't already tell them the answer or don't make it seem like it doesn't exist because then they're not even going to try. And because I'm slightly skeptical at people's the effort that's being put into obtaining abstracts in full text, if you do say that there is no abstract, you're going to have to show screenshots stating that like showing how hard you tried to, because it's not professional or accepted in the research realm to just not include data because you're lazy and you don't want to find it. Like that is not how we're doing our research, right? So I went off on that tangent, which is a very important tangent for everybody who's watching because the data, like our research will be messed up if we just exclude things because we didn't put in good effort to find them. So getting back to it, were you able to find the abstract for this one?
Yes, I was.
Okay. And so what do you think? Is it now the only way that I feel like that the title restless leg syndrome would even be applicable to what we're doing is if somehow the people that with the restless leg syndrome were pregnant and then taking analgesics to treat it, in which case
Mhm.
we would include it. But I have a sneaking suspicion that that's not what it is. So, based on the abstract, what's going on?
It's about a woman having nightly insomnia for years. She's not pregnant though, so
Well, another key word, it's a small word with one letter. A. A woman.
a woman case report has to have three.
Yeah, so even if she was pregnant, it's an N of one, and so
Hmm.
we would exclude it. All right, so that is record number 4002. Now let's read record number 4003, please.
Record number 4003 is unexpected hyperkalemia following
Hyperkalemia, which is a lot of
hyperkalemia
potassium.
following
Succinylcholine. I got you. I
succinylcholine
got you, fam. Succinylcholine.
succinylcholine administration in prolonged immobilized parturients treated with magnesium and erythroid.
Okay, so parturients, which is a woman who is giving labor, well, in labor, having labor going on. So, well, actually, there's a lot of reasons we. Well, wait, I can't tell you the answer. You tell me what you got.
I got excluded because it's focusing on anesthesia complication during birth.
That is correct. And although interesting, and there's plenty of data about the analgesics that are given during birth, it would be interesting. However, it's not within the scope of what we're doing. And so, yeah, this person's in labor. So we're going to go ahead and exclude. All right, please read the title for the next one.
4004 is anesthetic management of obstetrical labor in parturient with
Obstetrical.
obstetrical labor in parturient with muscular
Parturient. Okay.
parturient with muscular carnitine palmitoil transferase deficiency.
There's a lot of big words in there. Um, but we don't really. What did you say about this one?
I said exclude because it clearly says obstetrical labor. So,
Obstetrical labor. And I think I
obstetrical.
posted that actually I was still in college, so older than you, and I was not pronouncing obstetric correctly. So don't feel bad. I turned out okay, and so will you. All right. So correct. Please exclude that labor. All right. And then the next one, go ahead. This is a quick one.
4005 is analgesia or labor pain, a cost model. So obviously labor pain, so exclude.
Correct. Then read record number 4006 for us all, please.
4006 is evolution and quality of care during labor and delivery in precarious patients who underwent early obstetrical analgesia.
Primiparis and obstetrical analgesia. Analgesia. Actually,
Analgesia.
I mean, it's a hard one. I don't know. I hope not. Nobody's judging. All right. What are you going to do with this record? Include it or exclude it?
Exclude and because it's labor focused.
Right. Now for record number 4007, what's your opinion on that?
4007 is prolonged coma and quadriplegia
Quadriplegia,
after accidental subarachnoid injection
subarachnoid, mhm,
of a local anesthetic with an opiate.
anesthetic, opioid. Let me read it. Prolonged coma and quadriplegia after accidental subarachnoid injection of a local anesthetic with an opioid. So See, this is big work. You're gonna be so smart when you're done with this. So what did you say, include or exclude for this?
I said exclude because of an anesthesia complication during labor once again.
Okay, so the what happened, so I can tell what's going on because obviously like I graduated from medical school, but for you guys, I really highly recommend you read the abstracts. So it sounds to me like what happened is this woman was actually, we don't know. We don't know if it's a woman. Why don't you go to the abstract? See, now we're making a lot of assumptions. Why don't you go to the abstract? Just from the title, I'm assuming that it's a woman. And
Hmm.
well, no, we're not going to assume anything. We're just going to look it up because we don't want, it seems like because there's such few research on any medication during pregnancy, if by some miracle we come across the very few research papers that do address this, we don't want to accidentally exclude it because it's kind of like gold, like we need it, right? So we should really read the abstracts more often, I think. But please, please tell me what you think.
So an abstract is not provided for this one.
Well, what do
I'm
we
trying,
do?
I opened the paper and tried to find an abstract at the beginning as well, but there's no abstract given. It goes straight into the case report paper.
Well, you kind of answered your own question.
But
It's a
since,
case
yes.
report. So another thing that I gleaned from this is that there's only one person with quadriplegia. So did you answer? You said exclude, right?
Yes, I did say
I
exclude.
said exclude because it seemed like it was one person.
Mm.
Um, and that's probably sufficient, but I just, for the purposes of this recording, want to get like into the nitty gritty because I think some people need to have a firmer understanding of the inclusion and exclusion criteria. All right, so let's do record number 4008.
Record number 4008 is fentanyl in emergency cesarean section in preeclampsia, complicated by the
So it's thrombocytopenia.
thrombocytopenia and
Very good.
abnormal liver function.
All right, so what did you decide about this?
I said exclude for this one
And why? Why did you exclude?
because it's cesarean, which is birth related.
Yeah, right. The medication is an analgesic. That's great. The woman's pregnant. That's great. But it's during birth. And additionally, it sounds like it's just one person anyway. So let's go to record number 4009, please.
Record number 4009 is a case report on drug screening of nail clippings to detect prenatal drug exposure.
Yeah, what do you think about that? I
I
mean,
said,
this is how nerdy I am. I actually went through, and even though there were some studies that are excluded, I really want to read them anyway. So I put them in a separate file for me to just read for fun, which is, I know, it's nutty. But anyway, what did you say about this paper?
I said exclude because it's not the pregnant population.
Yeah, well, it's prenatal drug exposure, so it is the pregnant population, but it is, first of all, a case report and it's on nail clippings, so it doesn't really talk about like the maternal fetal or neonatal outcomes, right?
Mhm.
So it's definitely pregnant people because it says prenatal drug exposure, but the reason that you would want to exclude is because it's a case report and
Case report.
it's about the nail clippings, which I thought was cool, but I'll read that later. Okay, record number 4010.
Record number 4010 is a preeclamptic with coarctation of the
Coarctation.
aorta.
Coarctation of the
Coarctation
aorta.
of
So
the
what did
aorta.
you say about that?
I said exclude because it's labor focused.
No. Well, it is exclude, but it's exclude because it says a preeclamptic, which means one person and of one.
I see. Okay.
So a preeclamptic Well, why don't you tell me? Do you know what a preeclamptic is?
Um, is it like I'm trying to think.
First of all, is it a animal, vegetable, or mineral?
It's a person for sure.
Yes. Okay. So we've established that a preeclamptic is a person. Now, is this person a man or a woman?
A woman because
And is this
preeclampsia.
woman pregnant or not pregnant?
I think she is pregnant because it's a pregnancy complication.
Right. So a preeclamptic is a pregnant woman. So we would include it, especially if the coarctation of the aorta was somehow a result of taking NSAIDs, but because it says a preeclamptic, I'm hearing feedback. I don't know if that's like my bad or if it says it's a preeclamptic, which means it's just one
Mhm.
person, n equals one. So that's why we had excluded. Oh, now the feedback really intense. Um, but if a preeclamptic is exactly the patient population that we want to, it's a pregnant woman who's having, by definition, high blood pressure and protein in the urine. You've got to do something about that feedback because it's making me kooky. All right. Oh, it stopped doing it. So whatever button you hit, I like that button. Read 4011, please.
4011 is the effects of Entonox and epidural
Entonox and
analgesia
epidural analgesia.
on arterial oxygen saturation of women in labor.
Ah, what do you think? Include or exclude?
Exclude labor focused. I see what I did here. I think I accidentally put labor focused, read labor focused from the last one when I should have. I think I got confused.
That's okay. This is what we're here for. And I hope that everybody watches this video because I'm sure everybody's making similar mistakes, but not to worry. Okay. 4012, please.
Extradural opioids in labor, which is also excluded because it's labor focused.
All right. All right. 4013.
4013 is the South Med perineal suture study, a randomized comparison of suture materials and suturing techniques for repair of perineal trauma. So I excluded because it's not analgesic exposure focused.
Wait, it sounded like you said you included because it's not
Exclude,
analgesic.
exclude.
Yeah, it's about suture materials, not pain for the suturing. And yes, exclude. Read 4014, please.
4014 is second trimester abortion by Rivanol with or without cervical dilators, a randomized comparison.
All right. So what did we say about abortion? Which is not political. It's literally a medical term that can mean what there was incomplete and then excuse me, gosh. The chart that had all the different types. There's even an abortion that the baby doesn't even die. That's a threatened abortion whenever you're having bleeding and stuff. And you can actually fix that, right? So the general population has this like crazy like trigger warning like association with the word, but when you become a doctor we use the word differently. That was the slide with the millennial meme that says the I don't think that you're that word means what you think it means, right? So don't just throw it out because it says abortion. We need to know like what if it was the women, because it can't just be one woman, because then we would exclude it. But the women all took celecoxib, and then that induced a miscarriage, which if you're a scientist, you would use the word abortion instead of miscarriage. And then we would want that, right? So just because we see the word abortion doesn't mean that we throw it out. If the abortion does mean like it's an elective abortion and it's at the end of the pregnancy, it would be similar to medication taken during labor, and then we would exclude. So we need to know what type of abortion. So what I still am hearing feedback. Um, why don't you tell me what you said, either include or exclude? There was like a period of time where I didn't have any feedback. So whatever that button was, you press that again. I'd say it could be my fault, but I'm not touching anything on my, my computer. So whatever you did, do the opposite of that because now it's a whole lot worse.
I'm able to control it.
Maybe if you get a cool headset like me, see how cool it makes you look?
It's giving IT queen.
Thanks. Did you try shutting it off and turning it back on?
I'm trying. Okay, I don't see any other buttons other than record for me. Maybe it's show captions, but that's not on, so that's weird.
Wait, what? No, no, it's still doing it.
That's weird.
Well, I'll just have to like roll with it or whatever. Wait, it's done. Okay, can you? No, now it's back. I'll just talk very softly. I think that helps. Okay, can you tell me your inclusion or exclusion here?
So I said exclude. I first got confused by abortion. However, I noticed that Rivanol is not an analgesic, so that just low-key gave it away. It is like an antiseptic. So
Yeah, why don't you read the definition of what that drug is?
yes.
Do you have
It
earbuds you could put in or something?
um so this is my mom's computer, so I kind of don't have any Bluetooth connected to this.
That's okay. I'll just meditate it away. Tell me what
So
this drug is and what it does.
it's an antiseptic, so it does not fall under acetaminophen and acids or opioids. Um,
Analgesics in general.
analgesics, yes, in
Because there
general.
are, like, for example, this is posted on the stream, like ketamine is an analgesic and it doesn't fall into opioids or NSAIDs or acetaminophen. So there are like random things that don't fall into those categories. So, and then another thing is that there are medications that do other things, and then they happen to also be analgesics, in which case we would want them. So just because the medication is in one category doesn't mean it could not also be an analgesic. And the example that was posted in the Google stream of this, while you're telling me more, I'm going to look that up because that was an important. It was well, it'll be in the assignment that comes out today. So basically the point of what I'm saying is just because a drug is in, I don't know, antihypertensive or something, doesn't mean it couldn't also be an analgesic. So you don't want to just assume it's not an analgesic because it also does something else. So, but
Yes.
we're pretty sure it's not an analgesic.
Yes, because it's a synthetic dye used for second sem trimester induced abortion.
So the key here is induced abortion, right? And if it's
Mm-hmm.
purpose, then we're not looking at it, right?
Yes.
Okay, so we excluded that one. Now let's talk about record number 4015. And by the way, you told me you have until 10, right?
Yes.
Okay. If I don't think I'm gonna make you read the titles to all 200 of them, but I do think that it is going to be helpful for everyone because, as you can see, there's a lot of words in here that are like really difficult to comprehend. And I feel like me explaining them now will prevent a lot of confusion in the future. So, all of your classmates owe you a round of applause for you doing this. All right. Excuse me. All right. The next one, in my opinion, excuse me, geez, is quite easy to figure out. What do you think?
Um, So marker number 4015 is suppression of lactation without estrogens. I said exclude for this one
And why is that?
because I believe it's something to do with postpartum.
Yeah, lactation
Mm-hmm.
after you give birth, and then that's not within the scope of what we're looking at. So yeah. Now 4016.
4016 is clinical trial of bar Barlgine during delivery.
To be honest, some of these drugs, I'm assuming that this, let's see what year. Tell me what year this came out.
This one came out, let's see, it should be on this nine 1974. Wow.
So here, if I see a drug and I have no idea what it is, I assume that the study is like 50 years old. Um, so this is in fact an NSAID, but it's not one that I've ever heard of, to be honest. So, okay, it is what we're looking for. So, what are your thoughts about it? And the
Let's
feedback is now super loud.
oh, okay, I said exclude because it's during labor. It clearly says during delivery, so
Yeah, that really that really is the ticket here. Um, but it was interesting to go down a 1970s rabbit hole of old school medications because I was like, what the heck is this? I was like, oh, way before I was even born. All right. So read number 4017, please.
number 4017 is analgesic and phlogistic action of benzidamine in obstetrics.
Obstetric.
Obst
It's a
obstetrics.
lot of,
Oh my
see,
God.
it's, don't worry. I didn't pronounce any of this stuff right when I was your age either. Okay. Now, what are these things and what are you doing about them?
So I did exclude because though benzidamide, from what I remember, has analgesic and anti-inflammatory properties,
It does, yeah.
um, I was thinking that it's more of evaluating symptom relief and perineal pain rather than the effects of analgesic exposure.
Well, I would say that we don't know that for sure until we read the abstract. So can you bring the
Yes.
abstract up? Because what if it was
Yes.
like, okay, we're looking at that, and then we found that all the women that used it, and it's usually a topical thing, by the way, all their babies had a third arm, or something like that. Then it would be like, whoa, this information we need. So let's read the abstract. Please don't tell me the abstract's missing. I was able to find the abstract almost all of these, so.
I'm trying to find it, but hopefully this is the one. This is not the one.
Hi, buddy. I took
Mm,
Tylenol when I was pregnant with you, and you seem fine to me. Yes. That's not dada.
so I can't find it, and I tried finding the article as well, but they didn't link it for some reason.
So we can't just exclude it because we can't find it because that's not
Hmm.
good science. Um, so what you said, you're telling me you said exclude, right?
Yes.
I excluded it because it's uh, uh, just the n equals one. So I didn't
Oh,
even
okay.
go and find the abstract. That made life a lot easier, right? But
Okay.
um if it was like fit all the other criteria, we would have to ask all the other students if they have access through their university and then send 2 screenshots of asking librarians because
Mhm.
yeah, is this a curse word? Don't be half-assed about it. Um, I just, I don't know if people say that anymore. It's basically like it just don't give up so easily is what I'm trying to say. Okay,
I think for
but
this one, the issue is not the access. I think it's just the PubMed didn't like link it. You know how on the side it usually links it. So it's really not there this time.
I
So I
just
think,
discovered it says article in Spanish, so we would exclude it
oh,
anyway.
okay, okay,
So
perfect.
so let me see if I can share because this is going to be important. I'm sorry, geez, I don't know what's going on. Let me see if I can go to like the
Oh, I
share.
see it now. I see it now.
All right, so this is going to be important for everybody. So share screen options. Oh my gosh, I'm going to end up messing this up. And wait, am I not sharing anymore? Okay. Here. Are you being able to see this where the title is and where it says article in
Yes.
Spanish?
Yes.
Okay, so I don't know how far into the recording we are, but I'm going to throw my hands up in the air because this is super important for everybody so that you don't waste hours of your time and stalking the librarians at school to find out that the article was in Spanish and we would exclude it anyway. Okay? All right, so that is a very good point. More hands throwing up so that I like when I go through the video again, I can that part will stick out. So let me go back to sharing the Excel spreadsheet. Please read record number 4018.
4018 is the anesthetic and obst ah, obst
Obstetric. It's okay.
obstetric management of the parturient with
Bacteria.
acute hepatitis.
Acute
Hepatitis.
hepatitis. Acute
Hepatitis.
hepatitis. So what do you think about this?
Exclude because it's a not analgesic exposure focused.
So some Well, I don't actually know this to be true offhand, but it is possible that an anesthetic could also be, yeah, nitrous oxide. So, yeah, ketamine. Yes. So, I do know this to be true. An anesthetic could also be an analgesic. And this is another important thing that just because it's in one drug category doesn't mean it also can't be an analgesic as well. Because there are so many medications that do more than one thing and fall into more than one category. So we can't assume that this is not an analgesic just because it says an anesthetic, right? Because it could be both. All right. So no. Go further. Extrapolate further for me, please.
I am looking at the abstract. Oh, it's a 24-year-old woman, one person excluded.
Yeah, it's just one person. And that poor person's got acute hepatitis. All right. Read record number 4019's title, please.
Grade number 4019 is analgesia without phenacetin. Satan?
Phenacetin. I mean, to be honest, I don't hear people
Phenacetin.
say this word. I'm assuming that this is also an old study. It's also like the vaguest title ever. You can't glean much. So
Yeah,
why don't we see if we can find an abstract? Probably from
yes.
the 80s or whatever.
It's in French, so it's excludes.
Oh, beautiful. See, you saved so much time by just seeing it's in French. Great. So we'll go ahead and record number 4020. Please read that time.
Clinical trials with the same spasmo analgesic, spasdoline and obstetrics, with an application of a new method.
That you got a lot of those words correct. All right, what do you think about this one?
I said exclude because it's labor analgesia only.
Where in the title does it say anything about it being labor only? I mean, it
I
probably
think I
is.
opened the abstract.
All right, so we can't tell from the title only if it is labor only. So you have to look at the abstract. Now tell me what it says in the abstract. What time frame did the spasmo analgesic get given to the pregnant person?
So I opened the abstract and it's in German, so it's already an
Well, then
exclude.
we'll exclude, but if it were in English, we would want to read to see at what point
Yes.
in the pregnancy it was given, right?
Mm-hmm.
Now we can go to record number 4021, please.
Onset of an acute glaucomatous attack.
Glauco, actually, now that you say it that way, that one doesn't sound so bad. So it's it is the state of being glaucoma-like. So glaucom, glaucomatous, not a word I say
Glaucomatous.
often. It's just basically like somebody just had glaucoma, which is pressure in the eyes. Go on.
Attack following a gynecological operation with the use of no novopone atropine medication.
Atropine. Atropine.
Atropine
All
medication.
right. What is your opinion about this? Include or exclude?
I said exclude because of a non-pregnant population, if that's right.
Well, okay, so it's a gynecologic operation, so we know that it's a female person, but is the female person pregnant or not? You probably want to read the abstract to find out.
Yes, I'm looking up the abstract
Because there
now.
are gynecologic operations that you could get while you're pregnant. In fact, we had
Mhm.
a whole slide about one. Do you remember the gynecologic procedure that happens during pregnancy to prolong pregnancy during cervical insufficiency?
Yes. Okay, I can't find it for some reason, but I believe.
To answer my own question, it was cervical cerclage. Remember how
Okay.
I added that slide later on to say that if an analgesic was given for that, we probably want it because that
Oh,
is a
yes,
gynecologic
yes.
procedure that occurs during pregnancy, not at the end of pregnancy. So the point of that is that
Mm-hmm.
there are plenty of gynecologic operations that occur during pregnancy, and so if a woman were to take an analgesic for that, we would want to include. But now we need to make sure. Jeez, what is going on? Okay. We want to make sure it's more than one woman. And did they see what happened to her, her baby? Do we know, or is the abstract again missing?
Abstract is really weird. I'm like going to different sites and trying to find it, but it's like not
Weird
there.
abstracts are my
It's being weird.
favorite. Okay. Well, send me the abstract. Oh, the article is in Czech, which is another language. So we're just going to exclude. Well,
Okay,
of
okay,
course, the
perfect.
abstract is weird. It's not in English. You can't read it. All right. Record number 4022, please.
4022 is topical lidocaine patch, 5% for acute post-operative pain control.
All right. So it's lidocaine.
Lidocaine.
And I am actually going to have to go into, although I wrote it myself, I haven't memorized it. The Prospero document. Tell me what you know about the Prospero document. The second Prospero document, because you've been with us since the very beginning. We have a first Prospero document for the giant mega umbrella study that we're going to do perfectly, right? But I
Mm-hmm.
also did a Prospero document for this stepping stone study about analgesics. So tell me a little bit about Prospero and what's in there. And if you can guess as to why I'm opening it right now.
Prospero talks about basically what we need to include and exclude. It the one that we just read is about like safety of analgesic medications during pregnancy because that's our topic. It focuses more on like interventions or exposures. We want to focus on analgesics, opioids, non-steroidal and anti-inflammatory drugs, paracetamol, all of that. And then we exclude like human studies, single case reports. It just tells us like what we're really trying to focus on specifically.
Right. So it's important to go back. And the thing I'm double checking is, did I say anything about topical analgesics? From what I remember, I didn't say anything about them, so we would
Mhm.
just include
Ex
them. But I just want to make sure I didn't randomly put in there that we were excluding topical because there
mhm.
are different routes. Tell me some different routes that you can use to consume a medication.
Some are oral. Most of them are actually oral from what I'm aware of.
Yeah, but there are other ways besides oral.
Hmm.
Tell me
There
other ways.
is, I believe in you can inject it as well.
Yeah, IV
IV.
or IM intramuscular injection.
Mhm.
Right. So I just opened up the Prospero and from like a quick search, it doesn't look like I said anything one way or the other about topical. In which case, yeah, topical lidocaine would be what we're looking for. Okay, makes sense. All
Mhm.
right. So we have what's the rest of them?
We have
Just read what are the ending words here? Acute post-operative pain control. But do we
oh,
know
oh, sorry.
but wait, do we know what operation and who got it? Or do we have to look at the abstract to see?
We have to look at the
Because
abstract.
if it's that the cervical cerclage, then that's an operation in the patient population that we're looking for. But if it's like a knee replacement for 13-year-old boys, then no, that's not an operation with the population. Can you say obstetric? I'll give it a try. Obstetric. No. No. Are you gonna be a doctor? Oh, this said obstetric. Good job, buddy.
Okay, I'm reading the abstract and it's focusing on a 39-year-old woman presented
Ah,
for elective
say
cesarean section.
less. Say less. It's just one woman. Let's go. N equals one. We're not gonna
Okay,
mess with
perfect.
that. You're gonna trip over the power cord back.
Hmm.
All right, so read the title of 4023. 23, that's right.
4023 is Association of Remifentanil Analgesia with Postpartum Depression and Birth Experience, an observational study.
Okay, what are your thoughts about this?
I got exclude because it clearly says postpartum depression.
Well, what's wrong with that? Wouldn't that be a maternal outcome?
It is, but it's using, I think they're using the drug after birth.
Where does it say that?
I think I read the abstract from what I remember for this one
All
because
right,
I
I need
wasn't
to make it
sure.
very clear that we in fact want to know about postpartum depression because that would be a maternal
Hmm.
outcome. Now, I understand what you're saying is the just because here I need to do another wave in the air. Just because it says the word postpartum doesn't mean the drug was given postpartum. It could be a result that occurred postpartum of a drug that was given during pregnancy. So let me repeat that again because this is exceedingly important. Just because in the title it has the word postpartum doesn't mean that you exclude it because the word postpartum could be referring to a consequence of a drug that was given during pregnancy. Okay. If it says postpartum analgesic use, you would exclude it because the drug was given postpartum, which is after birth. But if postpartum is being used to describe a time frame for a consequence of a drug given during pregnancy, you would definitely include it because that's exactly what we're looking for. So, do we get any further with this?
Yes, I'm looking at the abstract. It says to compare the childbirth experience and postpartum depression between the exposure group, which is the group receiving the analgesic, and then the non-exposure group.
Well, that sounds good, but we still need to find out when the analgesic was given. If this
Mhm.
analgesic was given all throughout pregnancy, for example, aspirin is given all throughout pregnancy, that's an analgesic to prevent preeclampsia, then that would be perfect and we'd want to include. However, if the analgesia that they're talking about was just given for labor pain, then we would exclude because that's not what we're looking for. So we have to get to the bottom of the time frame of when this remifentanil was given. Now, given that it is an opioid, I would say probably during delivery because
Mhm.
it's like not a good practice to just randomly get opioids throughout pregnancy. You know what I mean? So honestly, it's probably a analgesic that was given during labor, but we don't know unless we read the abstract and find out. And
I'm
if we
reading the
can't,
conclusion. Sorry, I'm reading the conclusion right now, and it says that these findings underscore a significance of using the analgesic as a potential approach for preventing postpartum depression and creating positive childbirth. So I think it's just during childbirth.
well, let me look at it because I kind of want to read the study just to make sure because I kind of like it. To be honest, I kind of like this study. Um, let me. All right. So you had written exclude because I'm about to give you the
Yes.
answer and I don't want to. Um, no, I wrote exclude, so I'm assuming what I did was found the abstract and found a reason why. Okay. Well, can you try to read the abstract to me out loud while I'm trying to find it?
Yes. So there's background methods, results, and conclusion. For the background, it says pain is a risk factor for postpartum depression. This study aimed to determine the relationship between remifentanil, remifentanil analgesia, sorry, and
It's
postpartum
fine.
depression, as well as the birth experience among Iranian women. For the methods, it says this observational study was conducted on 200 mothers who underwent vaginal birth at the hospital in Iran. The postnatal depression scale and the childbirth experience questionnaire were used to assess the outcomes to compare the childbirth experience and postpartum depression between the exposure group, the group receiving the analgesic, and the non-exposure group. The results just say that the mean postpartum depression score in the analgesia group was statistically significantly lower than the non-analgesia group.
Well, I do really like this study, but it kind of looks like the analgesia was only given in the hospital because what it does say conducted in the hospital.
Yes.
So, although I really like this study and I would love to know the relationship between analgesia and postpartum depression, it was only given during labor in the hospital, so we are unfortunately excluding it. But I'll probably read it for fun later on. All right. Good job reading all that. Your brain expanded, your little gray cells. All right. So let's go to 4024.
For 4024, it is quality of recovery after cesarean delivery in patients with class 3 obesity, a prospective observational cohort study.
Okay. And just to check, you can still see where I'm highlighting on my Excel sheet.
Yes, I could see that.
Okay. Because I want that to be recorded in the video because it helps to be organized like that. All right. So did you include or exclude this one?
I excluded because it's after cesarean delivery
Yeah.
and it's focusing on obesity.
Um, but do we know if first of all, wait, is there even an analgesic in this? Do we even see that somebody was given an analgesic?
I don't think it's just the quality of recovery after. So how they
Yeah.
recover, patients that have obesity, how they recover after.
All right, that's not what we're looking for. So let's go to record 4025.
Record 4025 is preoperative anxiety's impact on the median effective dose of
Esketamine.
esketamine for alleviating propofol,
Propofol.
propofol injection pain in patients undergoing painless abortion. And says a randomized double Oh my God, it's so hard to control and see this.
Well,
Randomized
you don't need
double-blind
to
control
read. You
trial.
don't need to read the abstract here because it's esketamine. So propofol is like it's makes you forget everything. Why don't you go hang out with Omi, buddy? She's not in a meeting right now, so you can go hang out with her. Go ask Omi for your water. Yeah, go ask Omi for your water. All right, so propofol is given like in surgery, and so the propofol is being given during this
Mhm.
abortion.
It's
It's not
induced
like
abortion, so
yes, yes. So we would exclude. If the esketamine was given randomly to the pregnant woman every 2 weeks throughout her pregnancy, um, then we would be interested in it. But it's not, so we're not interested. Record number 4026.
for
Wait,
4026.
this is also about esketamine. Okay,
Yes.
two esketamines in a row.
Effect of esketamine on postpartum depression after labor analgesia and potential mechanisms.
A
Okay.
randomized.
Double-blind control trial.
Yeah, so a randomized double blind. We like that because that's not a case study. Um, but it's wait, I won't tell you. You tell me. What's the
Exclude
phrase in there?
after labor analgesia.
Yes, that's the phrase after labor analgesia. Yes. All right. So record number 4027.
Record number 4027 is program intermittent in,
It's intrathecal bolus. Say
oh my God,
it with
intrathecal
me.
bolus,
Intrathecal bolus.
intrathecal bolus for maintenance of labor analgesia in obstetric patient, a case report.
Okay. So what do you think about that?
Labor analgesia, so exclude
Yeah, but also another reason for excluding.
a case report, so one
Right.
person.
Beautiful. Multiple reasons for excluding. Record number 4028.
Record number 4028 is effect of single intravenous injection of esketamine,
Intravenous.
intravenous injection of esketamine on postpartum depression after labor analgesia and potential mechanisms, a randomized double-blind controlled trial.
This is super fascinating to me because esketamine and ketamine have gone from being used usually in like horrendous car accidents, train stuff, like train wrecks and things in the field because it is a aesthetic and analgesic and like kind of knocks people out without doing the respiratory depression. The respiratory depression that you see in what category of analgesics? So our lecture yesterday, one of the big problems with one of the classes of analgesics is respiratory depression, which means you don't breathe well. What class was that? Starts with an O.
Opioid.
Right. Opioid, the problem with that is it makes people stop breathing.
Mhm.
Ketamine and esketamine doesn't have that as I don't know if it has that at all or it doesn't have it as much. And so that's why it could be used in the field, meaning like not in the hospital for like horrendous traumas. But it was found to also help depression and particularly decreasing suicidal thoughts and stuff. So this is interesting to me that they're using it for analgesic purposes and discovering as a result later on moms are less depressed. So I like this, but I think, well, let me see if I think I excluded it. So why did I exclude it even though I like it so much?
Exclude because even though the participants were actually pregnant earlier, the analgesic exposure tends to be like postpartum period, and the outcome is like maternal mental health after delivery.
Well, I'm very concerned with maternal mental health after delivery. Remember,
Yes,
we're
that is
not
why, but
we're not excluding things because it involves the
mental
way it
health.
affects a woman
Mhm.
after delivery. We're excluding things if the analgesic was given after delivery.
Yes, it's labor
So,
analgesia, so it's excluded.
so yes, I would love this study so much if the esketamine was given during the pregnancy, but unfortunately, it was given during labor, so we'll exclude it. All right, so now we have 4,029.
Record number 4029 is hypotension duration and vasopressor requirements following intrathecal oxytocin for total hip arthroplasty, secondary analysis of a randomized controlled trial.
You got those big words. So we have vasopressor, intrathecal, and arthroplasty. Very good. Now, what's your opinion on this?
I said exclude because it's not pregnant surgery.
Well, let's just because it doesn't have to do with pregnancy doesn't mean by some coincidence a pregnant person doesn't need it. Because what if you're pregnant and then you break your hip or whatever, right?
That's true.
So, do
Mm-hmm.
we know if the person or people in this study were pregnant? Or
I
are we
have
going to
it
have to
open.
abstract?
Um, it just says it doesn't say what the populations were.
Well,
I don't
that's
think it was
sad.
pregnant women though, because it's very vague. It just says 90 patients were included.
All right. So, now, I wish I could have a good example of this, but a lot of times in the abstract, it will have their inclusion and exclusion criteria for patient population. And most of the time, they exclude pregnant women for ethical reasons. And so let me take a gander about these 90 patients to see if it alludes to any of them being pregnant or not. Um, well, regardless, it doesn't explicitly say if anybody's pregnant or not, but it doesn't look like they look into maternal, fetal, or neonatal outcomes of it. It just doesn't really fall into what we are doing. And doesn't seem that it actually involves any analgesics either, because vasopressors, well, just because something's a vasopressor doesn't mean it can also not be an analgesic, but it looks like oxytocin. It doesn't look like it's even talking about pain. like it doesn't seem relevant. Let's go to the next one. Um record number 4030.
Record number 4030 is high volume patient controlled epidural versus program intermittent epidural bolus for labor analgesia, a randomized control study.
How do you like that? That's a mouthful. I mean, there's one word in here that you could just
Yeah,
find, and what's the one word?
labor analgesia.
Yeah, well, also epidural. Um,
Oh, yes,
well,
that's true.
okay, this is gonna get really crazy, and I doubt that this would ever happen. So, an epidural is something that women typically get when they're giving birth, but there are other procedures where you can get an epidural other than giving birth. And I doubt that there would be a situation where the study focuses on epidurals during pregnancy for things other than labor. But technically, hypothetically, there could be. Everett, do you want to go hang out with Omi? Technically, there could be, however unlikely, a procedure that a woman undergoes during pregnancy that is not labor where she gets an epidural. However, that's so unlikely that I think if we see epidural, we could safely assume that it is during labor and exclude it. However, if I was a perfectionist, I would say to make sure that the epidural is for labor and delivery. But also, this is about time management. And so I think the amount of time that it would take to look into confirming something that is probably 99% certain, confirming that the epidural was given during labor. I think it just wouldn't be a good use of our time. So we can assume that the epidural is during labor and we can exclude it. But also, it literally says the word labor analgesia in the title. So, yes, exclude. 4031, please.
Already looking like an exclude. Effects of labor analgesia with different concentrations
Wait,
of,
wait, wait. What about 4031?
oh, 4031. I see. My bad. Sorry.
Okay.
The effects of intravenous remifentanil on umbilical artery serum derived exosomes in pacients undergoing epidural anesthesia. A
I love
randomized
that.
oh.
Exosomes and parturients. And so did you include or exclude?
I excluded because it's focusing on labor
Yeah.
specifically. So
Yeah. Mm,
epidural again, and then
yeah, and
it says
also,
umbilical arteries.
yeah, that's not during the time frame we want. Record number 4032.
4032 is effects of labor analgesia with different concentrations of ropi, Vacane,
Ropivacaine. Ropivacaine.
ropivacaine on maternal body temperature and inflammatory factor, a randomized control study.
Did you include or exclude?
Exclude labor analgesia.
Right. Record number 4033.
Record number 4033 is patient experience with postpartum pain management in the face of opioid crisis. So, postpartum pain management, and then exclude because of that.
Yeah. So the pain medication, the analgesic, was given after delivery, so we would
Mm.
exclude. Record number 4034.
4034 is dose-dependent reduction in median effective concentration, EC50 of ropivacaine with adjuvant
Adjuvant,
adjuvant
like an
dexmed
adjunct.
mm, dexmedetomidine
All
in
right. So
labor
it's
epidural analgesia.
that's a hard word. Dex metadinamine. I don't know. I don't even know what that to be honest. So did you include or exclude?
Exclude because it literally says labor epidural analgesia.
Lovely. 4035. Record number 4035.
4035 is association of mood and anxiety disorders and opioid prescription patterns among postpartum women. Medication was given after, so during postpartum, so exclude.
Let's see. Associated mood and anxiety disorders, opioid prescription. Yes, the population is postpartum women,
Mhm.
so they're not pregnant anymore. Record number 4036.
4036 is use of novel and non-invasive respiratory monitor to study changes in pulmonary ventilation during labor epidural and analgesia.
What did you do with it?
Exclude because it's focusing on labor epidural analgesia.
Record number 4037.
Record number 4037 is effects on electroacupuncture
Very
on
good.
reducing labor pain and complications in labor analgesia process of combined spinal epidural analgesia with patient-controlled epidural, oh my God, epidural analgesia.
Well, what do you think about that?
I mean, it said epidural multiple times and then labor analgesia, so excluded.
Yes. And then do you remember why I said there's so many studies about analgesics given during labor, but so few studies about analgesics given at other times throughout pregnancy?
Because, I mean, analgesia is like pain control medication. Labor is a very painful experience, experiencing
Yeah.
more pain at that time. So,
Right. So in a pregnant population, you're I would venture to say most people get some kind of pain medication when they're delivering because it's super painful. So that's gonna be a definite thing. You for ethical purposes, and one of the reasons why there's such limited data on analgesics or any medications, frankly, during pregnancy is because it's not ethical to take a pregnant person and say, take this drug and let's see what happens. The only way that you can ethically get the data is if they voluntarily take it on their own for some reason, and then you use that information. And so I will tell you that women are quite likely to voluntarily take the pain medication during labor because that hurts. Um, and so there's plenty of opportunity to look into that because so many women get analgesia during delivery and labor. But there are a couple of reasons why you don't really have much data about the analgesics given during pregnancy, because one is like if a woman gets analgesia during pregnancy, the hospital and the doctors don't really know about it. She's just kind of taking Tylenol randomly at home for headaches or whatever. But in the hospital, it's like well known and doctors are aware because they have to like prescribe it and stuff. So one reason is that labor is super painful. So that is prevalent. Another reason is that the analgesia given during labor, the healthcare providers are aware of it so they can study it. But the analgesia that women take, like for headaches and different stuff at home during pregnancy, doctors and hospitals don't know about it. So how can they really study it unless there are the rare times where women go and tell their OB, like, oh, by the way, I took XYZ. And then if their OB even has the time, they could be like, oh, let's study and see what happens. And so the prevalence of the studies about the analgesia given during labor and delivery are so many 10, I think it's so like most of these studies, like 90% of them or more, are about labor and delivery because very common to take the pain meds there, and then healthcare providers and researchers are aware of it versus the offhand things that happen at home that doctors really don't know about for the random aches and pains and different things. So that's why there's quite a lot of analgesic during labor and delivery studies that we're seeing here. Um, what number were we on? 4,038?
38 now.
Okay,
Yes.
so this one should be easy to figure out by the title.
Multimodal general anesthesia approach to ex utero intrapartum therapy exit procedures. 2 case reports, which is less than 3, so exclude.
Yeah. This next one is the vaguest thing. Like, it's so vague. I have no idea what it's talking about. Go ahead and read the title. What is it? I don't know.
Caught in the crossfire of the syndemic.
What does that mean? We're going to have to go to the abstract. While you're looking up the abstract, and because I'm pregnant, I'm going to take a quick break. I won't go into details, but you find the abstract. Hopefully, it's not hard to find because the title tells us nothing.
So, oh, it's actually the first book. Perfect.
By the way, I'm not bringing my mic into the bathroom, so anything you say, I can't hear you. Were you able to figure out what these crossfires are or what?
Yes. So pregnancy wasn't specifically talked about, but it's more about like at-risk patient for HIV infection. So
Was
I
there
think we
even
can
any
safely exclude
analgesia
this.
used in this?
There is opioids.
What is syndemic? I don't even know.
Syndemic?
Why don't you go hang out with Omi? She's not on a call right now. You want, okay, come on. Let's show everybody your sword. Whoa, yeah.
Wow, that's so cool.
Yeah, it's cool. Thank you. Thank you. What's syndemic? Do we know? I honestly don't. So,
It
is
means when
it the
two or more
pandemic?
diseases, it's like two or more diseases or health conditions that
Oh,
cluster.
syndemic. Syndemic.
Hmm
Okay. Yeah, now that makes sense. Okay. I thought for a second it was a drug, and I'm like, what? Okay.
I think
We're
it's only in here because of opioid epidemic specifically,
Hmm.
but it doesn't make sense to be included for this because I mean it's about HIV infection. It doesn't say specifically pregnancy or maternal or neonatal effects or anything. So
Okay. All right. So let's, why don't you read to me? Can you not, can you not look at my screen, but look at only your answers and read
yes.
4040 or record number 4040 to record number, let's just do batches of 20. So
Okay.
read, do either say, you have to say the record number and then include or exclude, the record number, include or exclude, do the next 20. Because if we continue, like it's super important to read all of this, but we have to both go at 10.
Yeah.
Okay?
Okay, perfect. Okay. Record number 4040, I have exclude. Record number
I will
4000.
shout if I have something different. Okay?
Okay, perfect.
So
Record,
4040 was exclude. And then what?
yes. 4041 was exclude as well.
Hmm.
4042 was exclude.
Hmm.
4043 is exclude.
Hmm.
4044 is exclude.
Well, whoa, whoa,
4045.
whoa, whoa, whoa,
Ooh.
4044. Let's talk about that. Why'd you exclude it?
I said I believed it was not focused on this from, I think I assessed it through the title. I don't think I looked at the abstract for this one.
Well, I can tell from the title that I won. But I also know what an external cephalic version is, and you probably don't.
Mm-hmm.
And that's why we have to look up these things, right?
Yes.
And I think in one of the additional pieces of information on the stream, similar to, okay, why is the analgesic given for cervical cerclage included in our study? Remember, that was like a slide that I added and put it on the stream and I said, look, it's super important.
I'm trying to remember. Was it the one that we just recently posted and talked about?
Yeah, it was recently added. But why did I make such a big deal about it?
Because it's like I'm pretty sure it's used to like perform for like preterm birth risk in patients with like cervical if insufficiency
Which occurs at
or it's like
when does
current pregnancy.
right. So a procedure that occurs during pregnancy, the analgesics given for that, would we include or exclude them?
Include, of course.
Include. So an external cephalic
Hmm
version is a procedure that occurs during the pregnancy.
Okay, so we include it.
And so this is another point where I start waving my hands so that when I go through the video, I know that like this is important. If
Mm-hmm.
the analgesic is given during a procedure that occurs during pregnancy, not during labor, during pregnancy, we include it. Cervical cerclage is a procedure that people get analgesics for during pregnancy, so we include that. External cephalic version is another procedure that occurs during pregnancy. So pain medication given for that would be pain medication given for a procedure that occurs during pregnancy would be included or excluded?
Included.
Included. I'll say it again. Pain medication given for a procedure that occurs during pregnancy, not during labor, during
Is
pregnancy
included.
is included. External cephalic version is a procedure that occurs during pregnancy. Do we understand?
Yes.
So we would include it because
Mm-hmm.
it's not a procedure that happens during labor. It's basically when it's like Leopold maneuvers when a doctor kind of moves the baby so it's in a better position to later on come out better.
Mm-hmm.
Okay. You don't want your baby in the breech position. You want to turn it so that it comes out head first. Okay. So that is include. I mean, I'm not, even though, do you agree? Because we can't go on unless you agree, and I can't just override you. Because that's not how this works. It has to be two people. So would you change your mind to include it?
Yes, I would. After
Okay.
knowing what it is, then it's obviously include.
And that's why it's really important that everybody looks up what these things are. Because if you didn't
Mm-hmm.
know what an external cephalic version was, you might think it's something that happens during labor.
Mm-hmm.
All right, so continue, say the record number and include or exclude.
4,045 is exclude.
Mhm,
4,046 is exclude.
mhm,
4,047 is exclude.
mhm,
4,048 is exclude.
mhm,
4,049 is exclude.
mhm,
4,050 is exclude.
mhm.
4,051 is exclude.
Yes.
4,052 is exclude.
Mhm,
4,053 is exclude.
mhm,
4,054 is exclude.
mhm.
4,055 is exclude.
Yep.
4,056 is exclude. 4,057 is exclude.
Mhm,
4,058 is exclude.
mhm,
4,059 is exclude.
mhm.
4,060 is exclude.
All right, so that was our batch of 20, and
Mm-hmm.
it looked like we only had one disagreement. Did you have any questions about any of the previous 20 that you just did rapid fire quickly?
Nope, they all seem clear.
Okay. Let's do another batch of 20. So that'll be the next 20. So to 4,080, I guess. Yeah.
Yes.
You're not looking at my answers, right? You're looking at your own answers.
No, yeah, I'm just like super zoomed into mine, so I'm just trying to fix that really quickly.
No worries. Oh, and by the way, when the
Mm-hmm.
students are doing it, they should definitely. The only reason I'm sharing my answers is because I want them to come up on the screen for the recording for the other students
Mm-hmm.
to see. You guys should absolutely not share your answers with each other before hearing what everybody says, right? Because you have to do it independently or else it's not PRISMA compliant. Okay, I just want to point that out. We really have to follow PRISMA because if one person messes it up, then it can make it so that we don't publish anything. And wouldn't everybody cry if I would cry if that happened?
Okay. 4,061 is exclude.
Yeah.
4,062 is exclude.
Mm-hmm.
4,063 is exclude.
Mm-hmm.
4,064 is exclude.
Mm-hmm.
4,065 is exclude.
Yep.
4,066 is exclude.
Yep.
4,067 is exclude.
Yep.
4,068 is exclude.
Mm-hmm.
4,069 is exclude.
Yes.
4,070 is exclude.
Yes.
4,071 is exclude.
Mm-hmm.
4,072 is include.
Yes. And I actually added this to the Google Stream, which is why it's very important for everybody to actually read what's on there. Geez, I apologize. Heavens to Betsy. There is a critical thinking assignment that has to do with our population being specific to pregnant women, because there are certainly studies where, like, I guess the population, so for this example, it's school age boys, right?
Mhm.
And so I really need to like think deep and hard about this, which is why it's a critical thinking exercise. You all got like, I think, a month to do about the population. So we're not changing the population for the stepping stone analgesic study. Like, it's too late. We've locked in, right? But in the
Mhm.
future, it's like, do we make the population also babies and kids? And I think the answer is no. But like in this, it does appear that the population is school age boys, right? But the exposure happened when the pregnant person, like before the kid even existed, right? So this motivation, sustained attention, and autonomic regulation in school age boys exposed in exposed. Sorry, my kid is distracting me. Sorry, in urine, opioids, and alcohol. We want that because these are kind of like the long-term consequences. Like, these boys didn't exist when the thing happened, but they do now, and we want to know how they are. So yeah, we would include. But this is kind of even a concept that was going to require me like meditating on for days. But short, even though it doesn't appear that the population is pregnant women, it's still definitely something that we want to know about because it's an analgesic, right? Opioids. B, the exposure occurred when the mom was pregnant, and C, we have measurable outcomes. Um, they would be fetal outcomes, but like long term, because now the fetus is what, school age. So I like this study. We're including it, and I'm glad you got that. All right, continue.
Okay, perfect. I believe we're at 4,073.
We are, yeah.
Exclude.
Yes.
4,074 is exclude.
Yes.
4,075 is exclude.
Yes.
4,076 is exclude.
Mm-hmm.
4,077 is exclude.
Mm-hmm.
4,078 is exclude.
Mm-hmm.
4,079 is exclude.
Mm-hmm.
4,080 is exclude.
Mm-hmm. So that's another batch of 20. Did you have
Mhm.
any things that were confusing or that you needed to look in the abstract or you couldn't find? Remember, we can't just exclude it because we don't know where the abstract is. Are there any
Mhm.
issues with any of these ones?
No.
All right, let's go to 4,100. Ready? Go.
4,081 is exclude.
Yes.
4,082 is exclude.
Yes.
4,083 is exclude.
Mm-hmm. Mm-hmm.
4,084 is exclude.
Mm-hmm.
4,085 is exclude.
Mm-hmm.
4,086 is exclude.
Mm-hmm.
4,087 is include.
Yes! I love it. All right, tell me why you included it.
Um, it says during pregnancy, and off-label prescribing. So I was like, okay, since it says during pregnancy, that's like a first like a check mark. And so then I went and saw the abstract, and I believe it did include something about analgesics. So I was like, okay, I'm just going to include this.
Yes, exactly right. Yay. Okay. Next one.
4088 is exclude.
Mm-hmm.
4089 is exclude.
Yes.
4090 is exclude.
Yes.
4091 is exclude.
Yes.
4092 is exclude.
Yes.
4093 is include.
Whoa, you're on fire. Yes. Why'd you include it? I agree. That's what I got.
I include it because I believed when I read the abstract it had something about like pregnancy focus and like how like medication was during pregnancy, and it's focusing more on like after effects of the neonatal like abstinence syndrome. So I was like, okay, since it's after effects, so it's probably an include.
Yes, right. And this is another point where I'm going to raise my hand so that it stands out whenever I go over the video. The two things about neonatal abstinence syndrome, NAS, NAS, whatever you want to call it. What are the two things these Okay, so you go to the record, you read the title. It could either say one thing about neonatal abstinence syndrome, and if it's saying that thing, then we exclude it, or it says the other thing about neonatal abstinence syndrome, and that thing we include. Do you remember?
Um, I believe.
How about I name one and you tell me if it goes into the include or exclude?
Okay, yeah.
All right, so the title of the study is talking about an analgesic that is given to treat the baby's neonatal abstinence syndrome. Include or exclude?
Exclude.
Mhm. Now, the other option is the title of the study talks about an analgesic that was given that caused the neonatal abstinence syndrome.
If it caused, then it's include because it's given to the mothers. We're focusing on medications given to mothers and not the babies.
Yes, exactly right. So this study, I don't have the abstract in front of me, but when I read it, it was talking about the analgesic being the cause, right?
Mhm.
And of course, when we read the full text and we find out if, if maybe that's not what they're really talking about, then we can exclude it later during the full text inclusion or exclusion portion, which no one should have gotten to because that's a PRISMA violation. So yes, include 4093. And tell me about record number 4094, please.
94, I got exclude.
Correct.
4095, I got include
Yeah, wow. You did pretty good. This is impressive. Tell me why you included record number 4095, please.
because it's talking more about like medication, like pregnancy outcome afterwards, after the medication, and it's like showing like pregnancy loss due to the medication intake.
Now, I was afraid that you would see the word antithrombotic and assume that an antithrombotic could not also be an analgesic. However, there are indeed many antithrombotic medications that are also analgesics. And so I'm glad you didn't just toss it out because you assumed that the antithrombotic medication couldn't also be analgesic, because in fact, a lot of them are. So even though it doesn't say analgesic in here, if you go to the abstract, you'll see a lot of the antithrombotic medications that they're speaking about are analgesics. And so
Mhm.
these medications that these women are taking throughout pregnancy, it's talking about the outcome, and that's exactly what we're looking for. So good job including that. Very impressive. I thought that one would trip you up, but it didn't. All right, go to 4096.
4096 is exclude.
Correct.
4097 is exclude. 4098 is exclude.
Mhm,
4099 is exclude.
mhm,
4,100 is exclude.
Yes.
4,101 is exclude.
Wait, were we only going to 4,100? We can keep going to 4,120 before we pause to regroup, but
Okay,
4,101 is exclude.
exclude. Yes.
Okay. Tell me
4,000,
about 4,102.
4,102 is also exclude.
Mm-hmm.
4,103 is exclude.
Mm-hmm.
4,104 is exclude.
Mm-hmm.
4,105 is exclude.
All right. So I got include. So that doesn't see we still just because probably should take my word for it doesn't mean you'll just say yes, let's include it. You gotta tell me why and we have to agree. Because
Hmm.
although very unlikely, I am not perfect. So maybe I'm wrong. So tell me why you excluded this one.
I think for this one,
4,105. Yeah.
I think for this one, when I was thinking about childhood asthma, I was thinking of far like older. Like I remember like before we like went back to like the study of like the boys in school and like how they had like the thing and we had to use critical thinking for that. I don't think I like thought the same way for this one. And then over the counter probably threw me off. So,
Well,
but I
here it's
see
just a
that
yes. It's a yes or no question. It's not a trick. Can you get analgesics over the counter?
yes.
Okay. So you don't want to throw it out.
Tylenol.
Just,
Yeah.
yeah. All right. So if you go to the abstract, you can see. um, So we have the mother's use of over-the-counter medications during pregnancy, which we love. That's exactly what we're looking for, is the mother's use of medications during pregnancy. We just need to make sure they're analgesics. So
Mhm.
let's look. Okay, so there's plenty of people in this study, so N is way more than three. And then
Mhm.
allergic rhinitis. Yeah, paracetamol is one of them. So bam. Um, that's an analgesic. So we want to read the full text of this, okay? Do you agree? You're allowed to disagree, you know.
Yes, I do agree. However, I have a question. So, if it focuses on more than one medication, but one of them is an analgesic, do we still include?
Yes, and I gotta throw my hands up in the air. Wee. Um, yeah, if it's like a study about 99 different medications and just one of them is an analgesic, we would want to read it. It would be
Okay.
included for the next phase. That's a good question. All right, tell me about 4,106.
4,106 is exclude.
Mm-hmm.
4,107 is exclude.
Mm-hmm.
4,108 is exclude.
Mm-hmm.
4,109 is exclude.
Mm-hmm.
4,110 is exclude.
Mm-hmm.
4,111 is exclude.
Mm-hmm.
4,112 is exclude.
Yeah, and how vague is that title?
Uh-huh.
I'm assuming you read the abstract for that one.
Yes, I did.
Okay. Tell me about 4,113, please.
4,113 is exclude.
Mm-hmm.
4,114 is exclude.
Yep.
4,115 is exclude.
Mm-hmm.
4,116 is exclude.
Mm-hmm.
4,117 is exclude. 4,118 is exclude.
Mm-hmm.
4,119 is exclude.
Mm-hmm.
And 4,120 is also exclude.
Right. Okay, good. Any questions, concerns, or additional thoughts about any of the 20 that we just did before we do 1,120 to 1,140?
No, no questions at all.
All right, tell me about 1,121.
4,121 is exclude.
Mm-hmm.
4,122 is exclude.
Mm-hmm.
4,123 is exclude.
Mm-hmm.
4,124 is exclude.
Mm-hmm.
4,125 is exclude.
Mm-hmm.
4,126 is exclude.
Mm-hmm.
4,127 is exclude.
Mm-hmm.
4,128 is exclude.
Mm-hmm.
4,129 is exclude.
Yep.
4,130 is exclude.
Yes.
4,131 is exclude.
Yes.
4,132 is also exclude.
Yes. And I want to interrupt briefly. So for any of the students who are watching this and then your brain just tuned out because it's repetitive, record number, exclude, turn your brains back on because you guys need to be following along by reading the titles and mentally noting, okay, I see why it was excluded. Because I understand with the repetitive nature of this project, you may have turned your brains off, but the whole point of this is for you guys to learn how to do this correctly. So as we're going through, the reason that I'm sharing my screen is because I want everybody to read along. So please don't turn your brain off, read along. And maybe we're saying exclude, and you're like, wait a minute, that title looks like something I would have included. Write that down and ask a question about it. So this is a general announcement for the group as a whole. Don't turn your brain off. Read what we're doing. Okay. All right. Sorry for the interruption. Please go. Were we on 4,132, 4,133?
4,133.
Okay.
That is exclude.
Right.
4,134 is exclude.
Right.
4,135 is exclude.
Mm-hmm.
4,136 is exclude.
Mm-hmm.
4,137 is exclude.
Mm-hmm.
4,138 is exclude.
Mm-hmm.
4,139 is exclude.
Mm-hmm.
4,140 is exclude.
Okay. Now I'm going to jump in again here. Is that there are, of course, shortcuts that you guys can take. For example, having uh, one student just kind of write include or exclude on their own, and then at the Zoom meeting, talk about it. But because I am a little bit concerned for the lack of understanding amongst some students, I want no one to take any shortcuts with anything. Another shortcut that we could take is I could just say, okay, just tell me the next time you see include. Instead of going through each record number and saying include or exclude, I could say, all right, whatever, just tell me the next number that you included. That would be a shortcut. And if you guys were experts at this, that's fine. But I wouldn't classify anybody in this group. Go ask your Omi for some food, buddy. Yeah, I know you
Yeah,
want
I
me
know
to
you
give.
want me.
So basically, I understand that you may see avenue for shortcuts. Please don't take them. Okay. Let's go to record number 4,141, please.
4,141 is exclude.
Okay.
4,142 is exclude. 4,144 is exclude.
Wait, can you tell me 4,143?
Yes,
Honey, can you
exclude.
not play with my computer, please? Why don't you go see what your grandmother is doing? Because I'm a very busy person and I have to have more than one computer. All right, can we go back up to 4,143 about gout, please?
Yes, 4,143 is exclude.
Yes, that was exclude. What about 4,144?
That's also exclude.
All right, 4,145.
Exclude.
Mhm.
4,146 is exclude.
Okay,
4,147 is exclude.
yes.
4,148 is exclude.
Okay.
4,149 is include.
Yes, it is. Why did you include it? I'm delighted.
I read the abstract and it talked about, I'm pretty sure it talked about like, trying to remember what it talked about because I forgot to write it down. But
let's just bring it up real quick because I think it would be
Yes,
good for the whole group to learn. Why
because
don't
it looks
you read the title for our audience members, and then I will go over the abstract.
okay, perfect. Role of thromboxane A2 in the vasoconstrictor response of the endothelin 1 and angiotensin,
Angiotensin too.
angiotensin 2, and the 5-hydroxytryptamine in human placental vessels.
So good, so many big words. Yes. All right. So that was a mouthful. All right. So vasoconstrictor. So just because something is a vasoconstrictor doesn't mean it also cannot be an analgesic because
Mhm.
it can be. Um, Vasoconstrictor agents present the circulation. They mediate the effect on placental blood flow. So we already know that someone's pregnant in this study, so that's good. Placental, I don't even know that word to be honest. Normal pregnancies are perfused in vitro. Oh, yeah, hold on. There was some reason, there was something. Okay, so it used aspirin and endomethacin, which are the analgesics that we like. But here's the thing. Didn't we exclude in vitro studies? If we go back to the, yeah, aren't we like the exclusion criteria is in vitro studies, right?
Yes, it is.
That's too bad because I really like this one.
Yeah, because it really has evidence relevant to like how commonly used analgesics can like alter the placental blood flow. I saw that and I was like, wait, that's good. And I don't think I saw the in vitro placental
I know,
perfusion.
I didn't either. I read it and I thought, oh my gosh, this is perfect. But we did say we were excluding in vitro
Hmm.
studies. Well, let's see. Maybe some of these women took it in vivo, like orally themselves, not in a lab setting. Let me read a little bit more. I hope so because I really like this study. Yeah, I mean, this is an in vitro study, and even though
Hmm.
it's got good, that's too bad. Well, it's a good thing we went back over it because I didn't notice that part either. Um, yeah, I think we might have to change it to exclude just because of the fact it says in vitro. That's too bad
Yeah.
though, because I really liked it. What do you think? Should we change it?
I mean, if it was not in vitro, for sure, we should totally include it.
I know. I know. All right, continue on. See, this is why we
4,150.
gotta go over these things multiple times because even I can make mistakes. I didn't even see the whole in vitro thing. All right, so 4,145.
1,050
I'm
is
sorry. What number are we on?
4,150.
Man,
It's
I got
exclude.
something. Hold on. Oh, I got thrown off because I had to change my answer from include to exclude for 4,149. So 4,150 is
Exclude.
okay, 4,151.
Exclude.
Okay.
4,152 is exclude.
Yes.
4,153 is exclude.
Yes.
4,154 is exclude.
Yes.
4,155 is exclude.
Yes.
4,156 is exclude.
Yes.
4,157 is exclude.
Yeah, and that word is empyema. Keep
Empire.
going. Hmm.
4,158 is include
Yes. And why'd you include it?
because it's long-term effects of prenatal medicine exposure after prenatal
Yes.
medicine exposure.
This is
So,
exactly what we're looking for, right? All right,
mhm.
continue.
4,159 is also include
It is also included in how come?
because it's the pregnant women when they were taking opioid before their birth. So
Yeah,
its effects are measured after.
right. Okay,
4,160 is exclude.
correct.
4,161 is exclude.
Yes,
4,162 is exclude.
yes,
4,163 is exclude.
yes,
4,164 is exclude.
yes,
4,165 is exclude.
yes,
4,166 is exclude.
yes,
4,167 is exclude.
yes,
4,168 is exclude.
yes,
4,169 is exclude.
yes,
4,170 is exclude.
yes. And I'm going to jump in here for our audience members to remind you to not tune everything out because it's just repetitive record number, exclude, record number, exclude, record number, exclude. Everybody who's watching this needs to be following along and reading the title, okay? Because this is how learning happens. All right, please continue.
Okay.
We're
Did we
on
leave off at
4,000. We're at
4,170? Yeah. Okay.
4,171.
170.
4,170 was excluded. 4,171
Okay.
is,
Exclude.
it is.
4,172 is exclude. 4,173 is exclude.
Mm-hmm.
4,174 is exclude.
Mm-hmm.
4,175 is exclude.
Mm-hmm.
4,176 is exclude.
Mm-hmm.
4,177 is exclude.
Mm-hmm.
4,178 is exclude.
Mm-hmm.
4,179 is exclude.
Right.
4,180 is exclude.
Yeah.
4,181 is exclude.
Mm-hmm.
4,182 is exclude.
Mm-hmm. Yeah. Go to 4,180. Are you still there? Uh-oh, we're
5
frozen.
is,
Sorry, you froze. Can you go to 4,183, I think?
yes. 4,183 is exclude.
Mm-hmm.
4,184 is exclude.
Mm-hmm.
4,185 is exclude.
Mm-hmm. All right. So because we do have time and we're reaching the end, let's read the titles for the education of our audience members.
Are we doing 4,185?
Yeah, just read that one and we'll talk about it because we definitely need to explain our reasoning for some of the individuals. Actually, it wouldn't hurt everybody to just know what is going on in the brain during this. So read record number 4,185's title.
Case of general anesthesia combined with epidural anesthesia in pregnant women undergoing thoracotomy for
It's
spontaneous
thoracotomy, but I mean, if you say it
thoracotomy.
that way, I don't think anybody would really get upset because that's a decent way to pronounce it too. You're doing so good. Oh, this last word, this one's
Oh
fun.
no. For
Yeah.
spontaneous.
Come on,
Do
give
we
it a
pronounce
go.
that the same way as pneumonia?
Yes, go ahead. You're onto something here.
Pneumothorax.
Yes, it's
Okay,
pneumothorax.
perfect.
Wow, your brain is going to be so much bigger after this meeting. You're going to know all these super big words. Yeah, pneumothorax. All right, so did you include or exclude and why or why not?
I
All right, we're frozen again. Hmm. And I don't know how this is going to affect the Zoom recording. You froze? So can you tell me if you included or excluded?
yes, I excluded because it focuses on epidural anesthesia.
Yeah, which, like I said earlier, it is technically possible to have an epidural for a different procedure during pregnancy. And if we were perfect and we had an endless amount of time, we would go into each and every abstract and see if the epidural has this 1 out of 10 billion chance that it was for something other than labor and delivery pain. But because we don't have an endless amount of time, and this is about time management, we're going to go ahead, and I hate to say the word assume, but we're going to assume the epidural was for labor. Does it say labor in there or just says epidural? I
It
mean,
just says epidural.
yeah, it's 99.999 epidural for labor. And so that's not what we're looking at. All right. Read the next one.
Oh wow.
This is really important because I'll just tell you it's oligohydramnios, or this is oligoamnios. It's usually oligohydramnios. So I don't really know about oligoamnios, but I know that
Oligoamnios.
oligohydramnios is a known and established side effect of NSAID use during pregnancy. So I'm gonna put my hands up in the air. Is that you guys need to know what polyhydramnios is and what oligohydramnios is. Now, this has got to, let me get the PowerPoint out because this needs to be an actual slide. Because this is another thing where it could either be the cause of or a treatment for. So I'm not going to explain it super well right now because I'm actually opening the PowerPoint and making a note for myself to make a whole slide that does explain it well. But well, hopefully, like my brain can do both things at the same time. So basically, taking NSAIDs during pregnancy has been known to be associated with oligohydramnios. But because it causes oligohydramnios, if the mom's problem is the opposite, which is polyhydramnios, taking NSAIDs actually is the treatment. So taking NSAIDs would be a treatment for polyhydramnios, and taking NSAIDs causes oligohydramnios. I don't know if that made sense, but let me find the PowerPoint so that I can like go ahead and make, because that's going to be another kind of like the patent ductus arteriosus situation where taking NSAIDs during pregnancy causes premature closure of the ductus arteriosus prior to delivery, but it actually is a treatment for patent ducteria. Oh my gosh, the DA closure after the pregnancy. And so it's one of those situations where it causes something, but if your problem is the opposite, it's actually the treatment for it. So it's kind of analogous. And I still haven't found, let me find the PowerPoint. I need to stop talking so I can, because I definitely need to add this to the PowerPoint because it's super important. Um, so I'm adding a slide to the PowerPoint about polyhydramnios and oligohydramnios. All right. So poly means what? What is poly? Let's break down these words. You don't even have to look them up. You can just break them down and know what they say. So what's poly mean?
Many.
Many, and then what's hydra?
Hydra is water.
And then amnio, like amniotic, right? So what do you think polyhydramnios means using those three definitions?
Water.
Many, water, amniotic. So what would be many, water, amniotic?
Um,
Let's think about Goldilocks, okay? And instead of porridge, it's amniotic fluid. Okay? So you want a Goldilocks zone of amniotic fluid. What happens if you have too much amniotic fluid? Do you think that's polyhydramnios or oligohydramnios?
that's polyhydramnios.
Yes. So let's just to get it straight. What is polyhydramnios? Sorry, you froze again.
I believe it's like fluid buildup.
Too much amniotic fluid. Okay. Oligohydramnios is the opposite, which is
Less fluid buildup.
correct. Okay. See, you don't even need to look up these words. You can just break them down. All right. Read the title to the next study, please. Oh, did we say? By the way, that was exclude.
Yes.
4,187 is what?
Clofenet, a review of its pharmacological properties and therapeutic efficacy in rheum, rheum,
Rheumatoid.
rheumatoid arthritis and allied rheumatic disorders.
Yes. So let me read that. And why don't you bring up the abstract? First, tell me what you got and then bring up the abstract. I would say it's
I
alclofenac,
got include for this one.
Okay, I did too. Alclofenac, a review of its pharmacologic properties and therapeutic efficacies in rheumatoid arthritis and allied rheumatoid disorders. I said include, you said include. Why are we including?
Hmm. Okay, basically it's an anti-inflammatory agent.
So yeah, we have
So
the
that
right
falls in
drug.
first.
We have an analgesic, so we like that, right? Go on.
Mm-hmm. Um, Other drugs. I am pulling up the abstract. It's more about like remove. It's like about the arthritis joint disease. It doesn't have a specific population. It just
Yes,
says Welsh patients.
unfortunately, we didn't get a good example today, but a lot of times in the abstract, it'll say, and I had said this earlier in the presentation, it will say the people or patient population that it excluded from the study. And most of the time, for ethical reasons, it does exclude pregnant women. Okay. And so you can usually go to the abstract and see excluded pregnant women, and then we would do what with it?
We would exclude it.
We would exclude that study. But in the event like this, where it doesn't say whether there's pregnant women or not in the study, we would have to include it so that we could do what next?
We can read the whole entire article and then screen it
Yeah,
that way.
right. So we have to include it so that we can read the whole thing and know if there were any pregnant women. All right, you froze again, so I don't know. I don't know if it's going to mess up the recording, but I'm just going to repeat that if it doesn't say whether it's pregnant women or not and it looks pretty good, just include it so that we could read the whole text and find out if there's pregnant women. So yes, include. Please go on to record number 1188.
4,188 is a case of thoracoamniotic
Yeah,
shunt for
yeah.
a congenital cystic
Mhm,
adenomatoid
mhm.
malformation.
Yeah, so the words are a case of thoracoamniotic shunt for congenital cystic amniotoid malfunction. Oh, edematoid. I mean, honestly, it doesn't matter. Did you include or exclude?
I excluded because there was no analgesic exposure.
Well, it doesn't look like there is, but you would have to read the abstract, but it just says a
Hmm.
case of, so I didn't even read the abstract. Makes sense. It's just
Yes.
n equals one. So maybe somewhere in here there's an analgesic, but I'm not going to go find out because I'm excluding it because it doesn't have enough people. We
Hmm.
need three or more people in the study to include it. All right, read to me. So many big words. It's so exciting. 4,189.
4,189 is case of general anesthesia for subtotal thyroidectomy
Yeah, thyroidectomy.
in pregnant women with 27-week gestation.
Yes. What did you do with this?
I excluded
And why did you exclude it?
because it's an anesthesia case report on a
Yeah,
pregnant woman.
I like that we're 27 weeks gestation. And maybe the anesthesia is also an analgesic, but the reason for exclusion is that it's a case. We don't have enough peeps. All right. Why don't you read to me 4,191?
Okay. Anesthesia for a pregnant patient with ruptured
Cerebral,
ar cerebral arteriovenous renal
arteriovenous. Yeah,
venous malformation.
correct. And what did you say about this one?
I said exclude for this one. It would be trippy at first because of anesthesia, but I think I opened the abstract
The
and figured it out.
anesthesia could
The
be
abstract was a
also
little bit more.
analgesic.
Mm,
So
yes.
anesthesia, it could be an analgesic. So you go to the abstract and see is it an analgesic? So what's going on? Yeah, I mean it says fentanyl. So the drug is what we want, but what is in here that we don't want that is causing us to exclude this record?
It's a pregnant patient.
It's A, one, singular, pregnant patient, N equals one, exclude.
Mm-hmm.
Exactly. Please read to me the title of record number 4,191.
4,191 is essential thrombocythemia in pregnancy.
Thrombocytop thrombocytopenia.
Oh, wow.
Oh,
Thrombocytopenia
yeah.
in pregnancy. Report of 4 cases.
All right. What did you
I
do?
included this one
I also included this one. Why don't you tell me why?
and could be more specific if I pull up the abstract.
Yeah, go ahead. I invite you to. All right. So we know from the title that it has a good sample size. We're looking
Mm-hmm.
for N equals three, meaning there's three or more participants. So there's four. So that's good. We like that. So we go to the abstract and then we see, okay, pregnant people. Great. What else?
It's talking about spontaneous abortion. It's not induced. It happened because it's like a miscarriage.
Yeah, it's not like the non-medical professional whenever they hear the word abortion.
Mhm.
It's a miscarriage, right? Okay,
Mhm.
so that's fine. What else is good about this study that makes us want to include it?
During pregnancy, and it's looking at effects after because it literally clearly says during the pregnancy.
Yeah, it's during the pregnancy. And what is the drug? Do we care about this drug? What is this drug?
Acetyl salicylic acid.
Okay, and do you know what acetyl salicylic acid is?
No, but
It's
I'm pretty sure when I search it
aspirin.
up. Oh, yeah.
We
Wait, I
love
do
acetyl
remember.
salicylic acid.
Did you remember? Yes.
Yes. So it has
It's taken
all the
orally
components.
too.
Yes, it has all the components of what we want. So we're going to include. Very good. Read the title for record number 4,192, please.
4,192 is an unusual cause of large bowel and
Bowel. So,
bowel
like your
obstruction.
large intestine, it would be your large
Mm,
bowel.
that I got exclude.
Correct. Whenever I worked in the ER on the Super Bowl, like I was getting bowl and bowel confused and mixing them up constantly. Read the title for record number 4,193, please.
4,193 is 2 cases of pulmonary edema during
Yeah,
and after cesarean section.
yeah. So did you include or exclude?
I excluded
And why is that?
cesarean. It includes after cesarean section.
And then why
It's two
else?
cases, so
Right.
it's not three.
Lots of reasons for excluding that one. Please read to me 4,194.
4,194 is massive hem hemorrhage.
Hemorrhage. That means you're
Hemorrhage
bleeding a whole lot. Massive
mhm,
hemorrhage.
during abdominal
Abdominal.
total hysterectomy in a
Correct. Oh,
patient with
you're good.
placenta precreta. Precreta.
Yeah, it's Precretia, but I mean,
Precretia.
I don't even know how anybody would ever know. All right. So did you include or exclude?
I got excluded for this one.
And why are we excluding it?
I believe it was not, it doesn't have analgesic exposure specifically.
Yeah, I mean, maybe, I don't know. I didn't read the abstract because first of all, it looked like case study n equals one. But
Mm-hmm.
anyway, if you're having a hysterectomy, uh, there's no way that you're going to be pregnant after that. Uh, and so
Mm.
because even if they were giving analgesics for this somewhere and it said that in the abstract, getting a hysterectomy, you're, you're not going to be pregnant after. And so it would be essentially like the same reasons that we exclude analgesia given during labor or given during abortion is because that's the very like last moments of being pregnant, and we're looking at medications for pain, analgesics that are given during the pregnancy. Now, tell me about 1,195. We only have five more. Is that exciting?
Perioperative, non-invasive cardiac output monitoring in parturients with singleton and twin pregnancies undergoing cesarean section under spinal anesthesia with prophylactic
Prophylactic, prophylactic,
phen
prophylactic. Phenylephrine.
prophylactic phenylephrine drip, a prospective observational cohort study.
Yes, and I would say, all right, perioperative non-invasive cardiac output monitoring in parturients with singleton twin pregnancies undergoing cesarean section under spinal anesthesia with prophylactic phenylephrine drip, a prospective cohort study. Okay,
That's a
okay.
mouthful.
Yes. Did you include it or exclude it?
I excluded because of cesarean section. It says undergoing, so it's during
Correct.
that time.
Right. Exactly. Record number 1,096.
Record number 1096 is anesthetic management of cesarean section in a patient with my
Myelodysplastic. Myelodysplastic.
myelodysplastic syndrome.
Okay. And did you include it or exclude it?
Exclude because it says a patient.
Correct. Just one. 1,000 or 4,197.
4197 is preoperative. Dextrose does not affect spinal-induced hypotension in elective cesarean section.
Did you include or exclude?
I excluded because it's looking at an effect during a cesarean section.
That's right. And also dextrose is just sugar. What about 4,198?
Anesthesia in pituitary with
Noonian. Noonian.
Noonan's syndrome
And include, exclude. What did you do with that?
because I believe when I looked it up, it was not focusing on pregnant women, but it's also
Well,
not an analgesic.
a parturient is a woman who is like in labor, and the anesthesia could be analgesic. But what there's
But
one
it's
word.
also a case report.
What is the one? Yes. What's the one word in here?
A
A, parturient, one. N equals one. Exclude. 4,199.
fetal toxic effects of angiotensin II
Yes.
receptor
Yes.
antagonists.
Yes.
Case report follow-up after birth.
Include or exclude?
I believe it's exclude. Yeah, it
Yeah,
is
why?
exclude because I think it's talking about one.
It is. All right, last one. And look at that, 9:57. Pretty good timing. See, that's why the theme is time management. We're so good. Read the very last one for today.
A rare cause of refractory severe polyhydramnios.
Remember the polyhydramnios?
Yes, I do.
Mm-hmm.
Anten Antenatal
Antenatal,
Barter syndrome.
antenatal Barter syndrome. And did you include or
Antenatal
exclude?
exclude because it's a rare cause.
Oh, yes, it was only one. Okay, that was amazing. You did such a good job. I am thrilled with your performance. I think that this is going to be a very good video for the rest of your interns to watch, so long as they remain aware and following along and don't zone out. And yeah, I think we almost got 99% the same. So, yay, you did
Mhm.
a good job. I'm gonna thank you and then hit end, and then hopefully Zoom will send it to me and then I will put it online. Wow, fantastic. Yay. Yay. All right. Take care and enjoy the rest of your day.
You, I have a question to ask you after this meeting.
Oh, you can just ask right now if it's not an embarrassing question and you don't mind it being recorded.
It's personal, so
Oh, okay. So let me end it. Do you want to email me the question, or is it so personal you don't want Gmail to even read it? Okay.
no, I think I can just talk about it on Zoom. It's just like a quick question. It's like school related.
Okay. But if I hit end, look, I'm just gonna hit end and then send you a new Zoom link because whenever I do it that way, I feel like Zoom sends me the recording faster than if I do stop recording and then do stuff off recording and then end it. It's just something weird I've noticed over time. So I'll just send
Okay,
you.
sounds good.
All right. Thanks.
Thank you.